Hi, everyone. My name is Mei Elansary. I'm a pediatrician and early career researcher, so a real pleasure for me to be here and to learn from my colleagues today. So I'm a pediatrician and my specialty within pediatrics is developmental behavioral pediatrics. So my clinical work often focuses on the initial evaluation of children with concerns about developmental delay in behavior, often in the context of poverty-related hardships and related stressors. As a pediatrician, my job naturally involves thinking about how both mothers and children are doing and how to support families to achieve optimal developmental outcomes, as we've heard from our colleagues today. I think this just builds off a lot of what we've been hearing today from colleagues. So the American Academy of Pediatrics recently came out with an updated policy statement on preventing early childhood toxic stress and emphasized the importance of relational health. Relational health is defined as the ability to form and maintain safe and stable nurturing relationships. And so while pediatricians and other early childhood professionals and researchers have long recognized the parent-child relationship as critically important, this policy statement is actually a really exciting paradigm shift for the field in terms of recognizing that these relationships, parent-child relationships, not only buffer against childhood adversity, but also promote skills that children need to be resilient in the future. So adversity in early childhood, as we've been talking about, can lead to lifelong problems in learning, and children of mothers experiencing poor mental health are at particular risk for negative developmental outcomes. The first year of a child's life is typically a very stressful time for mothers. It was for me, for both of my children. And although some degree of stress is normal, there is evidence that high levels of stress, the kind that stress that might get in the way of a mom's ability to take care of her infant or to be responsive and to create a healthy attachment, can be more problematic for children's development. Recent research has demonstrated associations between maternal stress and infants' brain activity as measured by electroencephalography or EEG, which Peter Walker has referred to in his work. And one factor that might directly shape parents' interactions with their children is their belief about whether intelligence is fixed or malleable, which we refer to as fixed or growth mindset. So maternal growth mindset is the belief that abilities can expand over time through effort and strategy. And maternal fixed mindset is the belief that abilities are innate and stay the same regardless of investment. Research has shown that mothers with growth mindsets interact with their kids in ways that promote learning. So we hypothesize that maternal growth mindset might be a protective factor against the negative impacts of maternal stress in child development. For this exploratory study, which is part of my fellowship research, we recruited 33 mother-infant dyads from a primary care clinic serving predominantly publicly insured children in Boston. We collected data on maternal stress, maternal mindset, and infant EEG recordings at 12 months. Here you'll see a picture of my colleague's daughter wearing an EEG net. And so the babies had their EEGs measured while their mothers held them and while they looked at a video showing infant toys. And the EEG measures brain activity and provides some information about how the developing brain is growing. In terms of what we look for for EEG, as children mature, brain activity becomes more synchronous, and we tend to see an increase in power across all of the frequency bands. And we also look for specific patterns in power, including decrease in the contribution of low frequency power to infants' developing brain, and then an increase in high power. And so what did we find in this study? So we found that infants raised by mothers with growth mindsets, as you can see in the dashed line in the figure, actually might be protected against the negative developmental consequences of higher maternal stress. So in particular, for those mothers with growth mindset, we see that there was no difference in EEG outcomes based on mothers' perceived level of stress. But for mothers who endorsed fixed mindsets, so the bolded line there, you'll see that EEG power was significantly lower when mothers endorsed high levels of stress as compared to low levels of stress. So this preliminary study confirmed our hypothesis that maternal growth mindset might be a protective factor against the negative impacts of maternal stress. In my current line of work at BMC, I've become more interested in maternal trauma as an adversity that impacts early childhood development. Trauma, as we know, is unfortunately very prevalent among low-income urban women. And although it's associated with multiple parenting challenges, relatively few studies have looked at objectively measured mother-child interactions in the setting of trauma. I'm presenting, this is data that we're working to get out, looking at 236 mother-infant dyads who were preterm born at area NICUs. And we found that a little bit counterintuitively, but promising for future intervention work, is that for mothers who reported trauma and were symptomatic, they actually interacted with their infants in ways that were more sensitive and demonstrated more dyadic reciprocity. So for my future work, I hope to think about how to leverage a strength-based approach to work with mothers impacted by trauma in early childhood settings. Thank you very much.